Hello everyone, I have a wonderful patient. She is actually just 6 days out from her explant. From 2005 is when she got her augmentation, and so this was 20 years later. Saline implants. The right saline implant was overfilled, the left one was normal filled. Now let me ask you this, 6 days later, how do you feel?
I feel very surprisingly good.
Like, define the word good.
Well, a lot of my, the symptoms that I had prior to the removal, I had dry eye, severe itching constantly, every single day. It was irritating to me and also to people that I spoke with, because I guess I was constantly blinking and I didn't even realize it. I've had neck rashes that were extremely itchy. Went to an allergist, spent $800, and all of his tests that he did came back inconclusive. And so I know it was related to the breast implants, and now they're out and I'm already feeling so much better.
Now, let me ask you this. You literally saw me the day before your surgery, even though you're local, and you were determined to getting this done. What type of preparation and homework did you do in order to get this determination that this is the right thing for you?
Yeah, well, word of mouth, some people that I know had been to see you, reading your Facebook page, the posts from the other patients, watching your videos, and really researching. And so I was sure that you were the one that I was going to go with for this.
Right. No, you were very determined. Now, let me ask you this. Let me say this. The dryness of the eyes, very common feature of what is suggestive and consistent with what is breast implant illness. Where you have dryness of the eyes and then like scratchy eyes, and patients are always putting in like eye drops just to kind of help with that. Now, how sure were you that this was going to help you before the surgery? Like, you were in pre-op, that was there a part of you saying don't do it, or how sure were you that this was going to ultimately help you?
I was 100% sure.
Wow. Okay. Now
I didn't know for sure, but in my mind, I was 100% sure.
Yeah. Now, what's interesting is, had you gone to the top 10 hospitals in the country, in the world, and you sought the 100 plastic surgeons who are top-notch, textbook perfect, you would have gotten suggestion that you remove your saline implants and get silicone implants in a heartbeat. That would have been their plan as far as that, and you chose to defy that. Why? Or you yourself did not want them replaced?
No, I didn't want them replaced, because that's how sure I was that all of these unexplained health conditions, rashes, itching, chronic sore throat, by the way, I didn't mention. It was just sore for about a year and a half, red, and I wasn't sick. And that's gone too.
The throat trickle, the throat trickle, Now, and as you will see, remember, it took you some time to get here, and we'll see where you are going to be. Hopefully we can catch up at week 6 or later to see your continued improvement. Because remember, this is where, when the surgery is done, you have those pictures and videos of the chest wall showing complete removal, and you have that the complete removal of the capsule number 1, and all what was removed was tested. Now, thanks for sharing your journey. Let me ask you this. How was your anesthesia experience? Do you remember anything?
No, I really don't remember anything. But I felt very calm and at peace getting on the operating table.
Got it.
Everybody had a warmth about them that just really put me at ease and rest. So, yeah, it was a great experience.
Right. Now, the other thing is, you clearly did not need the drains. You're 6 days out, and as you will see, as time will tell, between the recoiling of the skin, between the pseudo lift that I did, between the recoiling of the breast tissue, and between the breast tissue fluffing out as there is no implant pushing it, and between the 10, 15, 20% muscle mass that you're going to add to your chest from not only the pec major, pec minor, latissimus, deltoid, serratus, your posture is going to change only for the better, and your aesthetics is also going to change for the better. And as the swelling comes down as well. So we'll continue to see your progress overall. And I'm very happy to see your progress, and we'll continue to follow you over the next several weeks and months, and we'll see how you do. Anything you want to say to anyone?
Well, I would like to recommend to women that they obviously come to you for breast explant, implant explant, because I do believe that there's more people out there that are suffering with more things than I was suffering with. And I feel like, they'll be healed and they'll get relief finally. And I feel really good, really good.
Yeah, you look good. Did you seek out any other plastic surgeons for like a secondary consult?
No.
All right. Okay. All right. Now, thanks for sharing your journey.
Yes, thank you.